Hi, my name is P. Mahindru, and I'll be talking about cluster B personality disorders today. So there are three recognized personality disorders: cluster A, cluster B, and cluster C. Cluster A patients are usually categorized as odd and eccentric. Cluster B patients are categorized as dramatic and emotional, and cluster C patients are categorized as anxious and fearful. So talking about the cluster B personality disorders, there are four types of personality disorders under this cluster: antisocial, borderline, histrionic, and narcissistic. As far as the genetics are concerned, this cluster disorders have genetic association with the axis 1 disorders, which includes mood disorders majorly. First of all, the antisocial personality disorder, which includes the patients who repetitively disregard the rules and laws of society, and they rarely experience any remorse or regrets for their activities. It is seen more in males as compared to females, and there is a genetic predisposition with primary relatives being antisocial themselves. For the differential diagnosis, the first differential in this cluster antisocial personality disorder is the conduct disorder, which is diagnosed in a patient who is less than 18 years of age. Apart from that, the bipolar disorder and substance abuse can also prompt the antisocial behavior during the acute illness, but they remit when the disorder is controlled. The antisocial behavior with the antisocial personality disorder patients is state independent. Borderline personality disorder patients suffer from the instability in relationships, self-image, impulsiveness, and sense of emptiness, which is it is seen more in females as compared to males. And the females who experience such disorder have suffered from sexual or physical abuse, or even both. The differential diagnosis here is mood disorder and behavioral changes due to acute substance abuse. The histrionic personality patients exhibit excessive superficial emotionality, are attention seekers, and sexually provocative. They wear very loud colored clothes to look themselves attractive and are very sensitive towards criticism or rejection. These are the patients who have a familial link between the somatization disorder and antisocial personality disorder. The main differential to look for in such patients is a somatization disorder. The narcissistic personality disorder patients have a sense of grandiosity. They appear very arrogant, react to criticism with extreme rage, but suffer from extremely low self-esteem. As far as the differential diagnosis is concerned, here the grandiosity should be differentiated from the grandiosity in bipolar patients by the presence of mood symptoms in the bipolar. Now I'm just going to talk about a little bit about cluster A and cluster C as well. The patients in cluster A are defined as odd and eccentric, like I mentioned before. They cannot develop meaningful social relationships, but there is no psychosis. The genetic association is with schizophrenia. There are three subtypes under this cluster: paranoid, in which the people are always suspicious and they tend not to trust other people. Schizoid patients voluntarily withdraw themselves from society with very limited emotion expression, and they are usually content with their social isolation. Schizotypal patients have awkwardness in their nature. They have odd beliefs or magical thinking and have eccentric appearance. In cluster C personality disorder, these patients are defined as anxious and fearful with a genetic association with the anxiety disorder. There are three subtypes in this cluster as well. The avoidant people, who are very sensitive to rejection, are socially inhibited, timid, and have feelings of inadequacy. Obsessive compulsive patients have preoccupation with order, perfectionism, and control. And the dependent patients are submissive and clinging. They have excessive need to be taken care of with low self-confidence. The treatment and management for the cluster B, or in general the personality disorder, is psychotherapy, which is recommended for most of the personality disorders. Apart from that, the cognitive, behavioral, and family therapies are also used with such patients. The dialectical behavioral therapy, which combines standard cognitive behavioral techniques for emotion regulation and reality testing with concepts of distress tolerance, acceptance, and mindful awareness, is used for borderline personality disorder. Mood stabilizers may be used for mood instability and impulsiveness. Thank you.